Hi everyone. I'm so sorry we had a technical issue with Zoom. We'll have Holly join in. We have Mel already in there, and we hope to be back soon in like 2 minutes. Thank you so much for your patience.
Should we get started?
Yeah, I guess so.
I know we had a technical issue, a big one. Um, I'm glad we're back on, and I'm going to hand it over to you guys. Hi everyone, thank you so much for your patience. We had a Zoom issue and we couldn't log in on time, but we'll still like to go forward with this one. So here we are. I'm going to forward it to our experts right now, Mel and Holly, and they'll take it on from here. Thank you.
All right, thanks so much, Meha, for getting that all sorted out for us. So today we're going to be discussing how to avoid ACA penalties and staying compliant in 2026. So thank you for staying with us. Some of the things that we're going to go through is just an overview of ACA employer responsibilities, common ACA penalties and what triggers them, how to reduce your risk and avoid those costly mistakes, best practices, and of course, updates for the 2026 year. So for ACA employer responsibilities, the first thing that we're going to review is which companies must offer health insurance. If you're an ALE, so an applicable large employer, that's just an employer who had an average of 50 or more full-time or full-time equivalent employees in the prior calendar year. So let's say 2024, you only had 35, but then in 2025, you jumped over that 50 employee threshold. The first year that you're going to be filing is in 2026. The only exception for that is when businesses are opening up where they know their workforce is going to be exceeding 50 employees. So that's like factories, maybe, or a new Walmart, as an example. Then there's the aggregated ALEs. These are a combination of companies with common ownership, like child, parent, brother, sister, parents. These have a total of 50 full-time or full-time equivalent employees combined. So you have one EIN that maybe has 35, and then another EIN that has 20. You're over that 50 full-time employee threshold. So each of those EINs are going to have to file your 1095-C forms. If you're uncertain about your ALE status, we do have an ALE calculator on our website that'll help you determine that. And then we also offer services that are more in depth in calculating that ALE status. Holly, did you want to add anything about those services?
Yes. Yeah, so a little bit about our services. First of all, with this calculator, kind of you don't add like all the hours, you only add up to 120 hours of a person's when they're working during the month. And then you divide by 120 hours. And so that's the calculation that the IRS has provided us. So the service we offer is an employer will send us their variable hour part-time employee hours by month. And we'll basically do the calculation for them to help them determine if they are in fact an ALE. So we just do the legwork really. It's just a project cost. So I think it's like $250 to do that for clients.
All right, wonderful. Thank you. There are 3 criteria that your health insurance must meet to meet that ACA rules and requirements. The first being minimum value. This is coverage, it covers at least 60% of average medical cost, and it provides substantial coverage for your inpatient care and physician treatment. Then there's minimum essential coverage, or that MEC plan. This does satisfy the ACA individual mandate, such as preventative care and doctor services. However, I would like to note that for those plans that are a MEC only plan, that technically doesn't meet the ACA requirements. So if you have an employee go to the marketplace and get a subsidy, that could trigger an ACA penalty. And then the third criteria is affordability. Does your lowest cost employee only premium, and that is after the employer contributions, does that meet the affordability requirement? And it doesn't really matter what the employee ends up choosing, what plan they end up choosing. What matters is that you offered an affordable insurance plan. Now, who should ALEs offer insurance to? That's your full-time and full-time equivalent employees. That means that these employees are averaging at least 30 hours of service per week or 130 hours per month. And that also includes any services where they're getting paid. So vacation, PTO, that also counts towards their hourly employment. And then if you have like those variable hour employees, to establish their full-time equivalent status, we would use an established measurement period. And Holly's going to go more in depth on that measurement period in a couple more slides for you guys. So essentially, if they're full-time, you need to offer insurance to them. So when does a self-funded employer need to file? They need to file regardless. What changes is what type of form you end up needing to file. So those that are considered an ALE, so that's that 50 or more full-time equivalent employees, you need to file those 1095 and 1094-C forms. And then for those self-funded or level-funded employers with fewer than 50 full-time or full-time equivalent, you're required to file the 1095-B forms. And the difference between these two is that your B forms, really, we just need to know who was enrolled including the dependents, and at what point in time were they enrolled throughout the year. Whereas your C forms, we want to know if you were compliant in offering insurance is essentially the difference. So with what we just covered, the reporting requirements, so the code 6055, that's essentially saying that you're verifying compliance with the ACA's individual mandate. So again, did this person have coverage and when did they have it? And then the code 6056, that's just verifying compliance with that employer shared responsibility laws. So were you compliant in offering to all your full-time employees? Another thing to consider is if you have more than 10 tax forms, you need to make sure that you e-file all your forms. And then we now no longer have that individual automatically sending individual forms to your employees. But what you need to do now is post information that's available to all your employees, letting them know that they can request a form. And if they do request that form, it needs to be distributed within 30 days. And you need to make sure that's posted by March 2nd of 2026.
So we're going to look at what the penalties were for 2025. And I just want to just say that the IRS is always about a year and a half behind. So they haven't started assessing the 2025 penalties. They're on 2024 still, but we'll go ahead and move on. We'll take a look at the first set of penalties. If you go the next slide. So in 2025, this is employee shared responsibility payment, ESRP. And in 2025, that actually went down from the year before. So it changes every year, and it's based on two types of penalties. The first one is under 4980 HA, so we call it the A penalty, and that's if the employer doesn't offer health insurance that meets ACA requirements that to at least 95% of their employees. And that one, if it's assessed, it's based on how many full-time and full-time equivalent employees you have. So for example, we have a restaurant client who's a restaurant owner and have several of them, and they've decided that with the turnover and with kind of seasonal, that they don't offer health benefits, and that's certainly an option to do. But they still have to report because they're an aggregated ALE. And so what happened, but they're only being assessed on their full time. So, and then that's prorated amongst the related companies. So maybe one cafe only has 5 full-time employees. So, and then it's only triggered if any of those employees actually go to the marketplace and receive a premium tax credit. So, but if you're a bigger employer, you're a big ALE, say maybe 150 people, what the IRS does is if one person triggers it, it applies to all full-time employees minus 30. So if you had 150 full-time employees, it would be assessed on 120, and that would be $2,900 per person per year. So, but that went down from the year before, but it is going to be going up. And Mel's going to talk a little bit about that. And then the B penalty, that is if you don't meet either affordability or minimum value. So Mel mentioned earlier that MEC plans could still cost you a penalty. And again, it's triggered by somebody going to the marketplace and receiving a premium tax credit. The penalty itself is a little bit more. In 2025, it was $4,350 for the year. That is divided by month. And that penalty only applies to that person that flagged. Now, sometimes we have employers that 10 people got flagged. And so we do where we help employers, identify what happened and what was really going on, and we help respond to those letters. And next slide. Now there's penalties for late filings and also errors. So when we first started doing ACA, they had a good faith waiver. And so if you messed up a little bit, the IRS really didn't do anything. But then they said, okay, no good faith waivers anymore. And that was a few years ago. So if you're more than after 30 days late, then it's a $60. So before 30, sorry, within 30 days, it's a $60 per form. It used to be per form as the form sent to the employee and the form sent to the IRS. Because of the recent changes, it's not necessarily to the employee if you can show that you've put up a notice where the employees can request their forms. If it's after 30 days and it's before August 1st, it's $130 per form. And if it's after August 1st, it's $340 per form. And intentional disregard, it's $660 per form. And all the ones above that, they have, I'm just looking here, they all have maximums. So if you're a large business and you're getting charged $60 per form, that total penalty would not exceed more than $683,000. And so that goes up with the 130. But if you just decide you don't want to file, it's $660 per form. So we tell clients, even if you're not offering benefits, but you're an ALE, you still need to file because you're still, apt to get some of these penalties if you don't. Next slide. So what can you do to avoid some of these penalties? Well, because if you want to go to the next slide, because they got rid of the good faith waiver, you definitely want to make sure that your data in whatever systems you're using, payroll system, your HRAS system, your benefit system, say like Employee Navigator, or ADP, or whichever one that you use. You want to make sure that good data in is good data out. And so make sure the data that you are putting in the system is correct and current and always updated. And then you also want to make sure that you're offering it to the right people, the right employees. You want to make sure you have the information about your benefit information, the plan year, what kind of plan you have, who's it offered to, and when, who signed up. Because this is the information that you're going to need to pull to fill out the forms. And then you'll need full names, addresses, social security numbers. We need to have ages if it's an ICHRA plan. If it's a self-funded plan and there's dependents, we need to have their names, and we either need to have their social security numbers or birth dates. That was another law that was recently passed where they used to say absolutely they had to have you had to have social security numbers, and now they're okay with birth dates. The employee should have a social security number. In fact, the IRS, if we try to submit it without a social security number, the IRS won't even take it. So go next slide. Now, I think the big thing and kind of one of the more confusing things is who do we offer? So obviously full-time employees that are hired as full-time, they're going to be full-time. You have to have at least no more than a 90-day waiting period. Most companies that we see anymore is like first of the month following 60 or 30 days or on date of hire. Anyway, but what do you do with those employees who are, work variable hours? Well, you're required to put them in what is called a measurement period. And there are rules from the IRS about what these measurement periods can look like. So first of all, the measurement periods can be 3 to 12 months long. And there's two kinds of measurement periods. So there's the measurement period which is called the initial measurement period, where someone is first hired. And maybe that one is 8 months. And then concurrently, there's going to be an ongoing measurement period. And we usually see that run with the plan year. And so you're measuring their hours by month. And if they have more than 130 hours in, averaged in that time frame that you've selected, then they're going to be considered full-time and an offer must be extended to them. Then once that offer is extended to them, they go into what's called a stability period. And the IRS has said the stability period has to equal the measurement period, but cannot be less than 6 months. So it doesn't make a lot of sense to have any kind of measurement period that's going to be shorter than 6 months, because if you put somebody into benefits, they have to be in benefits for 6 months. You can't put them in just for 3 months. There is an administrative period. So if you're, for example, on the ongoing measurement periods, if we see people put their employees in maybe for 10 months, and it runs with the plan year, and then they give themselves like a 2-month administrative period, so they can calculate hours, that they can do like an open enrollment, and then they determine who can sign up for benefits. Now, there is a little caveat there for the initial measurement period. So when someone first starts, they are not permitted to go more than 13 months without a determination of an offer. So the longest the measurement, if you do a 12-month initial measurement period, you would only get 30 days. But you can have 90 days as a administrative period at any other time. You also, the B penalty, if it's a MEC only plan, that would trigger B penalty. If it's not affordable, and the affordability calculation is changes every year, so it's a different percentage. And there's a rate of pay and a W-2 and federal poverty level affordability. But if you're doing the rate of pay, you use the rate of pay and you multiply by 130 hours. Even if they're full-time, you think, well, that would be 160 hours, 40 hours a week. No, the IRS says you have to do 130 hours. And then you multiply it by the percentage that the IRS has provided for that particular year. Or you could do box 1 of W-2. In 2025, that percentage is 9.02. Last year it was 8.39%, and I think it's going up. Mel will go into that. And FPL is that's federal poverty level, so that changes every year. So it's the new federal poverty level multiplied by the new affordability percentage. So in 2025, that was 113.20. Again, you want to make sure that you're offering at least minimum value, minimum essential coverage to at least 95% of your full-time equivalent employees. So as long as you're following all these rules and calculating and putting, measuring people's hours, and then putting in information correctly so you can pull out the correct information, you should be able to do your reporting correctly. And that's the most important thing, because even if you don't offer, if you still have to report if you're an ALE. So the ways you could do this is, most plans anymore are going to meet the affordability requirements. Meet the ACA requirements, but not necessarily the affordability. what and it's really about the options. It's not about what the employees choose. So anymore, we see usually a high deductible plan option that is affordable, even though maybe not all the employees choose that, but at least it's an option. And it really is affordable only for the employee. So it even though you have to offer it to dependents, it doesn't have to be affordable for dependents based on the same guidelines. And then you want to make sure you're meeting the deadlines. There is an opportunity to do a 30-day extension. You can go on the IRS website. It's called the FIRE production system, and you enroll. There's also a form. It's called the 8809 form. You have to get it in before the e-filing is due, which is March 31st. But as long as you get that in, it gives you a 30-day extension, so it will take you to April 30th. The last thing, and this is something we do. So for our clients who we file for, we actually do this pro bono. It's part of the service. So if we file for you in 2024 and then you end up getting a letter, you can send it to us and we'll take a look and we'll help respond to the IRS on your behalf. However, we respond we'll take a look at any clients if they need some help with these letters. The most common one is called the 226J, and then it's followed up by 226L. They usually give you like a second notification. Those letters are about the employee shared responsibility penalties. So those are the ones that are in the thousands and thousands of dollars. So A and B penalty. The 5699 is the original letter saying that, hey, we think you're an applicable large employer. They're looking at the number of W-2s. And so if you aren't, you need to show why you're not. So again, that's where the calculations come into play. And then the 5698 is just a follow-up letter saying, hey, you haven't responded to our letter yet. So those letters have been 30 days. However, recently it's extended to 90. So I don't know if their letters are actually showing that yet, but in some of the new laws that were passed last year, that was one of them. You want to just make sure, you'll coordinate with your broker, your advisor. You want to make sure everything's in order before you respond. And then you want to respond timely and with explanations and receipts. And the biggest thing that we see is sometimes we get the final bill from the IRS that's been sent to the client. That means that they've ignored multiple communications. So when you get that, mail from the IRS, it's very tempting just to put it in the trash, but don't do that. We have a super high success rate of either abating all the penalties or a good percentage of the penalties. So address it as soon as you get it. It's just easier that way. Go to the next one. Oh, you're on mute.
Thank you. And for 2026, there are just a few updates that we're going to review. So we talked about 2025's ACA percentage threshold and how it's at 9.02%. In 2026, it's going to go to 9.96%. And that FPL or federal poverty level amount is going to be at 129.89. So what that means is if you offer your premiums that are at 129.89 or less than that, and you offered it to at least 95% of your full-time or full-time equivalent employees, you can use that FPL safe harbor. And that just lets the IRS know that They're going to look at the coding and see that you offered affordable insurance. Now, the employer shared responsibility penalty, it increased, I feel, quite a bit for 2026. It's at 3,340, and that's for that A penalty that Holly had discussed. So the A penalty is if you offered insurance or not to your employees. That's a $440 increase from 2025. And again, just a reminder, regardless if you offered insurance or not, you still must report to avoid that A penalty. And then there's the B penalty, that's at $5,010 for each employee. Again, it's prompted when someone goes to the marketplace and receives that premium tax credit. So if you have employees who got that, it's going to trigger a potential B penalty, and that's a $660 increase from 2025. And then the 2026 due dates. If you have the option to mail in the IRS, so if you have under 10 tax forms, you can mail those in February 28th, 2026. However, I usually just always recommend just e-filing the forms. And then to get your forms to the employees or to post the notice that they can request the forms, that has to be done by March 2nd of 2026. Your e-file forms, they need to be submitted by March 31st, 2026. And then we already discussed that e-file extension for the 8809, which is April 30th of 2026. So that is our presentation for the day. Are there any questions? All right. I don't see that there's any other questions. If you do have questions, please reach out to us and we'll help you out.
Sure. Thank you so much, Mel. And I know Holly had to jump on a call, so because of this whole Zoom technical issue, we got delayed. But thank you all for joining us. We had a great session. Thank you, Mel. Thank you, Holly. And if you have any questions, please reach out to us at solutions@hrserviceinc.com. And I will be sending out this recording to everyone who had registered originally, as well as people who are attending. And yeah, thank you for such a great session, Mel. And we'll probably have one more coming up soon. So stay tuned for that. Thank you.
Bye.
Bye.